people like Lester Levy, you remember him?
Yeah.
They say they're going to get rid of him, but go look on the company's register. He runs all of Health New Zealand right now. He's like the czar, the king of Health New Zealand, and has done a lot of mischief and made literally billions in cuts to public health care. He owned many private healthcare companies, or was a part owner or a founder of many of them. And I was looking because I was curious. The last I saw, he still had ownership, the last time I looked, of a couple of them that benefit from public monies being diverted into private. He was a part owner, of company director of New Zealand Musculoskeletal Imaging Limited. That ended in September of last year. And then New Zealand Cyclotron, which makes, I think, sort of radionuclide type stuff for advanced testing and treatment. And that relationship ended 36 days ago. So when your head of the public system is owning private healthcare companies, now I can't speak, I don't know if one or both of these gets government money, but we have to admit it's a bad look when privateers are heading up the public system. There's something wrong with that.
Let me just go through. I'm having a look at this company's page right now. There are lots of former directors and former shareholder, but it says Medical and Surgical Contracting Limited, shareholder. It says Australian Health Capital Management Limited, director. It says AAA Orthopedics Limited, director. There's other ones that may be medical, but they're not, don't call it, but there's Medical and Surgical Contracting Limited, director. The Ascot Hospital Management Limited, director. Health Capital Management Limited,
to be fair,
director.
I think you're probably looking at something that's been updated since that webpage went up, because I did read an article where he said before and during, while he's been commissioner or whatever his title is, he's been divesting himself of these things in a staggered fashion.
Well, if that's the case, then the government's got another thing against. I'm searching the companies registry, companies.govt.nz. So I'm looking at the company. I mean, if you ever close a business, that shouldn't take 6 months to get your details off there. That anyway.
Yeah.
We'll
if you look at the last Minister of Health, Shane Retty, he also has some ownership stakes in businesses. Businesses that, well, are they a conflict of interest if you're making money in the private sector and you're controlling government policy, voting to give, Philip Morris $216 million in tax breaks? I don't know. It needs to be addressed. Like, they could easily come out and say, no, I've divested myself from any private healthcare interest, which obviously is the normal thing to do. Like, maybe this is legal, maybe this is completely legal, totally above board, but it's something that they need to address publicly. And some journalist needs to be brave enough to actually ask them to come clean on this and just be straight up, because it's not a good look.